Today I'm doing a presentation on the molecular diagnostics dealing with cancer and HIV. What is molecular diagnostics? Molecular diagnostics is used by many laboratories so that lab techs are able to look at diseases on a genetic point of view. In this way, we are able to understand the diseases better so that we can focus on the core problems and find a cure in that way. In this way, we are also broadening the horizons of medicine on a huge scale. This industry is always expanding, and it is allowing us to improve the quality of life and increase life expectancy of people living with these diseases.
Sorry, I mean, I can see only the first slide. I don't know if you better come to the PowerPoint. Sometimes in these teams, you need to choose every screen, screen. Doesn't work for me. Only I can see the first. Okay, now it changed. Okay, better in this way. Perfect.
This was the second slide.
Okay, yes.
Okay, and this is the...
Sorry for the interruption.
No, it's fine. Okay, infectious diseases. In this presentation, we are focusing on the human immunodeficiency virus, just as Jacinta Convert focused on in his research. HIV is one of the most fatal diseases. Why? Because it, HIV is a globally fatal disease. It is most commonly known as a sexually transmitted disease, and there is no cure whatsoever. There are only antiretrovirals that are able to slow down the rate of deterioration in people. HIV is when the immune system cannot defend any outside infections for the body. And sooner or later, AIDS start to develop if the immune system cannot handle. With the HIV, they have research has found that there is an African potato that holds a cure for HIV, and this African potato has so much of poison in it that it kills a person before it even releases a cure for them. So there are so many different rumors that there are cures about HIV, but as today, there is none. It took scientists 20 years to develop antiretrovirals for HIV, and in that 20 years, so many people have fatally died. And HIV is so, HIV has,
Doesn't matter. You can breathe.
The reason why
really informal way, don't scare, okay? We are you and me only.
Okay. The reason why HIV is so difficult to find a cure for is because of its genetic variability. It involves so many different genes and so many different viral proteins that makes it so difficult to find a cure. If one thing works for one individual, it will never work on the next individual because the genetic variability may be completely different than the next. This makes it so difficult for people to even find one global vaccination because of its variability and genetic patterns. These are some of the signs and symptoms of HIV. These are some of the factors that increase the risk of HIV transmitted. As you can see, normally the most common ones are unprotected sex, STDs, and multiple sexual partners. The others is not so much, because unprotected sex, STIs, multiple sexual partners, that is the most common causes of HIV that increases the risk of HIV, and many of our individuals are affected in this way most of the time. These are some of the symptoms of HIV infections. As you can see, swelling, they have problems in their digestive system, they have weight loss and fatigue, and it slowly deteriorates them as the years go by if people do not take care of themselves. Okay, malignant neoplastic diseases, leukemia. Talking about acute lymphoblastic leukemia, this is a type of childhood cancer that involves the blood and the bone marrow. It is caused by an increased production in lymphocytes, and it is rapidly spread throughout the body. This is normally caused by arbitrary errors in the DNA sequence of the lymphoblasts. This is most common in children. Once it's detected quickly, it is better to find cures and to find a treatment for children living with leukemia. These are some of the signs and symptoms of leukemia. It affects the bone marrow directly. This is what it looks like under the microscope. And yeah, these are the symptoms. Acute myeloid leukemia. This is also similar to ALL, acute lymphoblastic leukemia. This is also dealing with the blood and bone marrow, but this cancer interrupts the production of white blood cells, red blood cells, and platelets. There's an abnormally large amount of blood cells, and this causes a lot of alterations in the genes, and it causes growth and differentiation. And the gene most commonly that causes these mutations is the GATA2 gene, and this error code causes the gene inability in preventing healthy white blood cells to be formed, and in this way the leukemia just grows with the mutations. This type of cancer is usually found among older adults, and the survival rate is not as high as ALL. These are some of the ways in which AML can be seen on people, and this is how normal blood is. And with leukemia, this is the production of the error of the mutations of the other blood cells. And this is how it looks under the microscopes. Chronic myeloid leukemia, CML, it's a spontaneous chromosome mutation, and it also commonly affects adults. This cancer is more fatal than AML and ALL, so it is better to try to diagnose it early. But the thing is, the symptoms of this cancer only shows in the most later stage, and in the most later stage, you already only have 3 to 5 years to survive. And if you find it even later than that, your chance of survival is much lower compared to ALL and AML. As I researched, I found out that there are very common symptoms of leukemia in ALL, AML, and CML. These symptoms are very closely linked. This makes it difficult to diagnose which type of leukemia a person actually has. And in this time, trying to diagnose a person, time is lost, and the survival rate gets lower over the time. With chronic myeloid leukemia, as you can see here, in the chronic phase, you only have 5 to 6 years of survival. And as it grows, it gives you a lesser chance of survival throughout the years. From years, it leads to months, and from months, it leads to days because of its accelerated growth in the body. Excuse me. Okay, now we move on to solid tumors. The glioblastoma. This is an antagonistic tumor that applies severe pressure on the brain and spinal cord. This is not usually genetically inherited, but it is sporadically formed. And this is most commonly when a person has other underlying syndromes that like accelerate the growth of the glioblastoma. For example, I know a patient personally who had a speech problem where they had problems with stuttering and stammering. And after taking the COVID vaccine, they have found that this this tumor had accelerated with its growth. And now they only have 3 to 6 months to live. They have actually 3 months to live. With a glioblastoma, you only have either 3 to 6 months to live. If you're living at 6 months, it's a bargain. This is how his x-ray looked. And on the brain, it's a huge tumor and it has tiny, tiny masses inside the tumor, which makes it difficult to operate. And even to operate, if you have to do a brain surgery, it's almost impossible to take out every single piece of the tumor. You have a 50-50 chance. These are some of the signs and symptoms of a tumor: headache, seizures, nausea, vomiting, self-identity issues. They don't even know who their own children are. They don't understand what they are saying. They have personality disorders. They do not have a very good death. They go fighting. Over here, you can see it looks like the brain is rotting in this region. This is what a glioblastoma normally does. It's very sad. Okay, a neuroblastoma. This cancer is normally found in children, most commonly. This is the creation of immature nerve cells that is found around the body. They usually find it in the adrenal gland of the kidney, and from there it is dispersed throughout the body, throughout the pancreas, the lungs, the eyes, and so forth. The survival rate is fortunately much higher than a glioblastoma, and detected early, it can be treated earlier and give the child a better life to live. This is normally by somatic mutation in the FOX2B gene, and this causes the occurrence of neuroblastomas. These are some of the signs and symptoms of a neuroblastoma. So if any of these signs and symptoms are found in children, it should be diagnosed immediately so that the child can have an active life ahead of them. Okay. Thank you so much.